Hi, my name is Julie Harper, and I'd like to talk to you about the use of psychotropic medications in children. First, I'd like to tell you a story about Michael. Michael was born perfectly happy, healthy, and met all his milestones on time or early. About age 3, he started banging his head on the wall. His parents asked the pediatrician what they should do about this, and she said he'll either quit when it hurts or when he knocks himself out. About age 6, Michael had escalated to ripping doors out the hinges. His grades were D's and F's. After these violent episodes, he wouldn't have any memory of them, just that he did something really wrong and terrible, and his self-esteem was very low. At one point, his parents were standing in their kitchen talking to some friends of theirs, and Michael attacked their child, choking her. It took 4 people to pull Michael off of the child. After that, Michael's parents again contacted the new pediatrician, who referred him for a psychiatric evaluation. At every visit, the doctor asks the parents, "Are you ready to do medication yet? Are you ready to do medication yet?" It was a repeated process, and the parents really wanted to try other things other than medication first, such as parenting techniques. But I'm going to come back to Michael's story in a minute. I do want to tell you a little bit about medication and the process. The research as far as psychotropic drugs in children, there's not much. There's very little. There's no long-term research as far as what the side effects are going to be for a child, say they start at age 8 or 9, if the drugs are going to have any effect on them at age 50. Psychotropic medications have not been used in children for that long. There's very few that are FDA approved. There is also the thing that I feel is most important is it is the patient or caregiver's responsibility to do research on the medications. So, since the patients are children, it's definitely your responsibility to research the medications. If you have questions, ask your doctor. It's very, very important. Asking your doctor questions is the most important way for you to get information and to feel secure in your decision. According to AHRQ Research Activities, the January 2000 edition, the average patient only asks 2.4 questions about their medication. That's just not enough to understand what the medication does, what the effects are, how it can affect you long-term, short-term, what the side effects are, what you should look for exactly. You're looking for all those questions to be answered. So the average questions that I would suggest to ask your psychiatrist is, how many patients do you have on this medication? What side effects have you seen exactly? Have you had to remove any patients from this medication? And if so, why? What's the maximum dosage of the medication? It's really important. Most psychiatrists will start off with a very small dose and work their way up, but you should always know what the maximum dose is. Now for the rest of the story. Michael's quality of life after starting medication along with therapy, his frequency of behaviors decreased from several times a day to once every 6 months to a year. His grades improved. He was on a honor roll. His self-esteem drastically improved. But medication alone is not the answer. According to Holman, from 2011, the child According to Holman, the Brown University Child and Adolescent Behavior Letter from July 2011. The article is Medication, What Role Does It and Should It Play in Treating Children and Teens? He believes that medication alone is not the answer. I do have to agree. There should be a combination of medication, therapy, and parent education. The more educated the parents are on the disorder and how to help the child have a better quality of life, the better off the child's going to be. I believe every child deserves to have a good quality of life, don't they? Thank you. Have a great evening.